Hello, everyone, and welcome to the online Pioneer Preview event, College of Nursing Graduate Session. I'm Melissa Rodriguez, Assistant Director of Admissions for the TWU Houston Center. At this time, I have the privilege of introducing Dr. Rosalie Mainous, the Dean for the College of Nursing at Texas Women's University.
Good morning, and thank you for everyone for coming. And I'm so excited to be here and to be able to address you. And I'm accompanied by some of my wonderful faculty, and they're the ones that actually deliver the programs that we have and we have national reputations in several areas. So I'm glad you're able to come. And can we get the slideshow started, Melissa, or do you want me to do it from here?
I can certainly do that for you, Dr. Mainous.
Okay, that's good. So I wanted to give you some background, some general information about what's going on in the college before we start talking about some specifics with the programs that we have. Back it up one, Melissa, please. So one of the things that we're doing that I wanted you to be aware of is that we're in the process at the state level of converting the degree that we have, the MS in nursing, to a MSN, or a Master of Science in Nursing. So that's currently under review, and we expect to hear something relatively soon on that, and we will publish the results of that. So we're excited about moving in that direction. I also wanted to let you know that we have two things that are under development that will be unfolding here soon and putting out for review. We are working on a BSN to DNP in clinical leadership. That is going also through the university, and then it will go through the state regulatory process in order to actually be approved, so that we'll be able to deliver that, but it's on the horizon. And the other thing that we're doing is we are moving to holistic admissions. And so we will begin to look at a number of variables with regard to admissions. Admissions will not be solely based on a number, but will have to do with a lot of different factors and look at everybody in a more holistic manner and what you bring to the table, and if you're interested and ready in graduate study. Okay, next slide.
Okay. I'm Dr. Rita Delastrito, and I am the track manager for the Adult Gero Acute Care Nurse Practitioner program. And the program, basically, when you do the Adult Gero Acute Care program, you're able to provide care from about the age of 13 and older. Just kind of depends on what institution that you work in, but that's the general consensus. And we also do prevention and management of acute and critical and complex chronic illnesses. Most people come into this because they want to do inpatient or specialty outpatient settings, such as pulmonary or cardiology, dialysis, renal issues, and things like that. The core courses, as you'll hear later on, is that all of our core courses are 100% online, and our acute care courses meet on Wednesday evenings or early evening, and we teleconference to Dallas and Denton students. The course is located in Houston, but we do have a multitude of students in the Dallas and Denton, Fort Worth area. And actually this semester I have a student from Austin and a student from Corpus Christi who also attend. And then our preceptors, our requirements for each course are listed here below, and that's consistent with all of the nurse practitioner programs. And here's my information if you're interested in the program. We do have faculty now up in the Denton area that take care of our students in the Dallas and Denton area. So that's all I have. If anybody's got any questions, please feel free to contact me.
Thank you, Dr. Delastrito. Next slide. So this will be Dr. Susan Kratowski, who I do not think is on the line today. So I will I'll go ahead and speak to this unless, Susan, are you on the line? I don't think she is. So let me just say that we also have the adult gerontology program in the primary care versions. That's the nurse practitioner track. So it is basically clients age 13 and older. It's outpatient ambulatory care, so it's primary care. It's not really restricted by the setting. It's more restricted by the type of delivery, which is primary care. So you have acute, chronic, and preventative care management. And the core courses, once again, are 100% online. And the clinical courses will meet on campus Wednesday early evening. And then in addition, of course, you have your actual clinical hours, your preceptorship hours, and they're done in internal medicine, family health, family practice, and women's health. You can see on the screen there the number of hours for each of the AGACNP courses. And Dr. Krastowski is available to take your questions if you're interested in this track. So next slide, please. So this track is, I've got Dr. Shelley Hawkins listed as the representative for you to call for questions, but I think today you've got Dr. Damon Cottrell on the line who will speak to the family nurse practitioner track.
Sure. Thank you, Dr. Mainous. This is Dr. Damon Cottrell, and I will speak to the family nurse practitioner tracks that are primarily based in Houston and in Dallas. The FNP is a primary care focused program where the student is exposed to all facets of populations, including pediatrics, adult, geriatric, women's health, and all of the above in both acute, chronic, and wellness type visits and management. You're probably seeing kind of a consistent approach here in terms of hours. The total hours is 630 for the program, with 90, 90, and 135 being in classes that are didactic and clinical focused, and then the preceptorship courses have more of a clinical focus attached to them as well. The core courses are 100% online, as well as those are shared with the other tracks, and then the on-campus meetings in this case is also on Wednesday, but typically in the morning hours. I will go ahead and put my email in the chat box for those of you who may have questions, or you can also reach Dr. Hawkins, who's the Associate Dean in Dallas, for anything other than that.
Thank you, and let's move on to the next slide. So this is our online version. I think Dr. Quisenberry's on.
Yes, hello, welcome everybody. So my name is Dr. Susan Quisenberry, and I am the Assistant Director of the FNP online program in Denton. I want to tell you just a little bit about our program. Dr. Cottrell and Dr. Mainous both spoke to the education of nurse practitioners, which are either a Master's of Science, a Master's of Science in Nursing. There are also postmaster certificate programs, which we have, and there are also DNP programs or BS into DNP programs, which we are looking at starting. The timeline for this program is about 1.5 to 2.5 years. If you're a postmaster's, it's anywhere between 1.5 to 2.5 years, depending on how many courses you'd like to take. Some of the responsibilities of nurse practitioners, Dr. Cottrell spoke to very eloquently. We look at health promotion and disease prevention and outpatient management of those individuals who need primary care, particularly any problems or health maintenance of those from birth to death. What do we do as a nurse practitioner? We do some diagnosing, we order and interpret diagnostic tests, we formulate and implement evidence-based treatment plans, That includes prescribing prescriptions. Interprofessional collaboration is a very main part of being a nurse practitioner, collaborating with other physicians, nurse practitioners, and specialists. We educate patients and families and communities, and we also make sure that we follow up to make sure our treatment plan has great efficacy. We do have a holistic and collaborative healthcare delivery, excellent healthcare and collaborative healthcare delivery, and we always have an ongoing evaluation of treatment efficacy. I did not put my name here in this slide, but I did put a link for you so you could click on and get information about our online program. I do want to let you know that our online program is here for you. It's geared towards students who are particularly working, and so it allows some flexibility for those who do have full-time, part-time jobs. And what we do, what is so special about our F&P program, is we bring the classroom to you. Our entire program is online with the exception of one on-campus intensive, and that happens during your advanced assessment about 12 months into your program. And that's where we have hands-on skills workshops, where we teach you suturing, joint injections, x-ray, EKG, things like that. We do offer our program in 13 weeks sessions, and we have intakes both in all in the spring, summer, and fall. We also have a no-worry preceptor placements, so we assist you in finding preceptors wherever you are. Our outcomes for our program, for the national certification, we've had 98% plus first-time pass rate. I'll go ahead and put my name and contact information in the chat box, and I look forward to hearing from you.
Thank you, Dr. Quisenberry. Can we have the next slide, please? Okay, the Pediatric Nurse Practitioner track is going to be presented by Dr. Barbara Gray, who is the director of our master's programs.
Hello, can you all hear me?
Absolutely.
Okay, great. Well, welcome to those of you who really, really love children. You are my people. And I want to tell you a little bit about the PNP track. It is a primary care program. It's a primary care program that provides care from birth through the age of 21, generally young adult age. And it focuses on prevention and management of common acute and chronic illnesses within the context of the family, community, and environment. It's geared toward care of children in ambulatory settings, outpatient settings, not inpatient, as would be with an acute care PNP program. As of this moment, we do not have acute care PNP, but this is primary care. As with the other adult GERO and the other non-online family track, the core courses are 100% online, but the clinical courses do meet on campus generally on Wednesday afternoons. The clinical preceptor hour requirement is the same as the other tracks that have been presented. And I would be more than happy to talk with you further about our PNP program. It's really learning the depth and breadth of pediatrics. So we really get into pediatric growth and development, and we look at the management, again, of common acute and chronic illnesses, and always remembering that children are viewed within the context of the family. Thank you.
Thank you, Dr. Gray. We have a next slide. Women's Health Nurse Practitioner track, and I don't believe Dr. Mendez-Bobsine is here. I think this is her practice day, so she's busy practicing as a women's health nurse practitioner, so I'll speak to this for just a minute. This track is primary care, and it's care to women across the life cycle, and the emphasis is on conditions that are unique to women. So from their menarche all the way through the remainder of their life cycle. Core courses, once again, online. Clinical courses meet on Wednesdays. in the morning, and this would be in Dallas. The clinical preceptorship hours, they are able to do hours in a number of different areas. So OB triage and high risk OB, which is a particular interest to a lot of people in this program, family practice and women's health clinics. Love taking care of women, and a lot of interest in this program. You can contact Dr. Mendez-Bobstein. She can tell you more about it. And the hours there are spread in the 5 main courses. You get some ideas on that. And please feel free to contact Dr. Mendez-Bobstein. Next slide. The nurse educator track is going to be presented by Dr. Susan Sheriff.
Good morning, this is Susan Sheriff. I'm excited to tell you about our nurse educator track. One of the things I love about the program is it is 100% online, except for 2 face-to-face practicums with highly qualified educators. And it is located in the city closest to you in Texas. So if you're in the Dallas area, we set it up in Dallas, Houston, or El Paso, wherever you are. But the first one is a clinical practicum, which is more hospital-based, and then the teaching practicum is more university-based. The primary focus is to make future nurse educators, and I'm happy to report that many of our highly qualified faculty in Dallas in our undergraduate program have graduated from this program. We also have an exciting thing. We have a nurse educator tuition award, and we find your eligibility upon admission, and we award certain monies to our nurse educator students to help them with their tuition. In turn, they teach for the state for up to 2 years. Like I said, all the didactic courses, all of our core courses, they're all 100% online, except for our 2 practicums. The practicums are really wonderful because I especially like the teaching practicum one because you're going to be a teacher. You get to work with some of the finest TWU faculty here in the state of Texas, and the students have just given the high ratings of the teachers teaching in that program. If you have any questions, please contact me. My email address is included, and I look forward to hearing from you. Thank you.
Thank you, Dr. Sheriff. Next slide.
Good morning. You can hear me okay?
Here we go.
All right. Good morning. I'm Dr. Robin Toms, and I'm happy to tell you about the Master of Science in Nursing Health Systems Management. This program is designed for those of you, well, let's see, it says share my webcam. Okay, I'll share it, but I don't, there I am. Okay. Programs designed for professional nurses looking to advance their career in leadership and executive roles. This could be in hospital, or it could be in long-term care, or actually any setting where nurses are present and need and nursing leadership exists. The program's designed with full-time nurses in mind, so you can complete this program while working full-time. I would say 99.9% of the students involved in this program are also working as full-time. Some of them are already in leadership positions and aspire to other leadership positions and advancement. So that tells a little bit about our student base. There are a couple of options. The one that is most popular and the majority of the students opt for is the 100% online. And that's an MS in nursing, or soon to be MSN, with a minor in business. So all coursework is online. There are dual degree options available. If you start that right at the beginning and you decide you want an MBA at the same to earn that at the same time you're earning your nursing degree, then we can set up that option. It may take you just a little bit longer if you choose the dual degree option. Most people just go straight for the master's in nursing option. There are 3 mentored leadership practicum courses. Each one of those are 90 clinical hours long, and you're paired with a nurse leader in your geographic area. So we have students that participate in this program all over the state, and actually we've had some students out of state participate in this program as well. So the clinicals, if you will, the practicums are in your own geographic area, and as I said, with a leader in generally in a health system that is close to you. Let's see, you can also, the other option is getting a minor or an area of emphasis in healthcare administration. That we say is 50% online. It actually is a little more than that online, but there are some what we call synchronous, or there are some courses where you connect with faculty and on a face-to-face basis. The third option there is a postmaster's certification in nursing health systems management, and that is available. It takes about 18 credit hours to get through that, and that's for those people that may have a master's in another field, perhaps a master's in education. I've had some D&P students come back and get a postmaster's certification in nursing health systems management. So that is designed for those folks who just want to augment their initial degree with an additional certification. Just a little bit about the coursework. There's a strong emphasis on financial, organizational, and outcome assessment competencies. All the competencies in this program are based on the American Organization of Nurse Leadership competencies, and also therefore and associated with that, the Healthcare Leadership Academy competencies. 41 credit hours, including 18 credit hours in your selected minor or area of emphasis. Most of the students complete in an average of 2.5 years, and that is working full time. Although, you know, it can be strung out longer than that if that is, it's really based on the student need, how long it takes, but an average of 2.5 years. Our preceptors are nurse leaders or healthcare executives in, as I said, in your geographic area. We found that our nurse leaders, our nurse leader colleagues are more than willing to precept and give back. And so our students have had some just excellent experiences with their clinicals and precepting. There's my name and my email, so please feel free to contact me if you have additional questions. There is a link at the bottom of that slide. I don't know if you'll have access to these slides later, but you can click on that and it'll take you right to the full curriculum so you can see what is involved. So that's this program.
Thank you, Dr. Toms. Next slide, please. And now we're going to talk about the DNP program.
Yes, good morning. This is Linda Roussel, and I'm so excited that you're here. And as Dr. Mainous shared, we are going through the approval process of our BSN to DNP in clinical leadership. Currently, our program only admits master's prepared advanced practice nurses, which includes our CRNAs, our clinical specialists, our nurse practitioners, and our certified nurse midwives. We have dropped the GRE requirement, and also we have recently received approval to eliminate 9 credit hours into our program. So what you'll see on our website is 49 hours, when in fact in the fall we actually will be requiring 40 credit hours. 95% of our students work full time. It takes about 2.5 years postmasters to complete the program. Most of our students take 6 credit hours per semester. We do have a requirement of 500 practice hours, which actually aligns with the DNP project, which is grounded in practice. Our project is mentored by our expert faculty, and we have clinical and community partners that work with us. Also, in terms of our program, we are considered hybrid, but primarily our didactic courses are online, and we do have some campus on-site meeting times. However, we are primarily online. I don't have my contact information here, but I did put it on the chat box. So we have a rolling admissions, so we can admit every semester. We primarily admit in the summer and the fall. So really excited about the program and our future plans, and look forward to any questions that you might have and interest. Thank you.
Thank you, Dr. Rosalie. Next slide. So now we're going to talk about the DNP to PhD and our PhD program, and that would be Dr. Cesario.
Hi, everyone. I'm Sandy Cesario, and I'm the director of the PhD programs at TWU. We have two pathways to our PhD, and the first one I want to mention to you is our DNP to PhD bridge program. There are a number of people who are DNP prepared nurses, lots of graduates, and who are finding they would also like to earn a PhD. The PhD in this track, or the traditional PhD program, is not considered a clinical degree, it's considered a research degree. So there's not clinical practicum hours per se, the focus is on research. This program is for DNP prepared nurses that want to advance their skills in the areas of nursing research, policy development, and education. Wide variety of backgrounds of our students, and it's very stimulating academically. The minimum requirements to be admitted to this program is you do have to have a DNP degree from an accredited university, and we also want you to make sure that you have had a graduate level nursing theory and research courses, but we do not any longer required standardized test scores. We used to require GRE and MAT, and we no longer do that. The only standardized test would be for international students. We do require tests of English proficiency. Our application dates, we have a single date now moving forward, which will be February 1st for the following fall. And it includes the regular application. We want to look at your CV and transcripts, reference letters, and a scholarly essay, as well as an interview. This program is 42 credit hours, and it does take about 3 years. Like our other graduate programs, the students in these programs are people working full-time and take approximately 6 hours per semester. A unique feature of our doctoral programs is that we offer them in 2 different delivery formats. We have a totally online program that's offered from the Denton campus, and what we consider a hybrid program that is offered by faculty on the Houston campus. The hybrid program does have some online courses, but most of the core courses do have a face-to-face component to them, which, being located in the middle of the Texas Medical Center, it's a great way to bring together employees from those facilities. My contact information is there. I am the program director. My email address and phone number are there. Please feel free to contact me if you need more information about this program. Next slide, please. This is very similar to what I just spoke to you about, but this is the traditional PhD in nursing science. This is for the nurse ready to assume or further their leadership position in nursing through research, policy development, or education. To be admitted to this program, you do have to have a master's degree, although not necessarily in nursing. We will admit registered nurses who have a master's degree in other disciplines, for instance, public health or informatics. It brings a lot of diversity to our groups. Interestingly, the PhD nursing science program at TWU is one of the largest and oldest PhD nursing programs in the United States. We have over 100 students enrolled as PhD students, which is a very large contingent of PhD students, and very diverse group, and you'll find that they're in leadership positions throughout the United States and some other countries. Minimum admission requirements are similar to what I said. You do have to have a GPA of 3.0 in your master's program, and but even if you have a master's degree that is in nursing or elsewise other than nursing, we do want you to complete a master's level nursing theory course and research courses prior to admission. And again, we don't require standardized test scores. The application materials are the same. They're due February 1st and include the same materials I just spoke to in the Bridge program. The number of hours for the traditional PhD in nursing science is 60. Again, almost all of our students are part-time, taking 6 credit hours, and it takes approximately 4.5 years to complete this program. That does vary somewhat depending upon what your research ends up being. Sometimes people can move through that in 2 or 3 semesters, and sometimes it takes a little longer depending upon the nature of the sample you're trying to access, the population, as well as the methodology and the data analysis that you use. So 4.5 years is, most people can complete it during that time, although some projects do take a little bit longer. The contact information for me is the same as I listed in the past slide, and let me know if you have any further questions.
Thank you, Dr. Cesario, and that is the end of our formal part of the presentation. We have taped this for use in the future, and we're opening it up now to see if there are any questions from anybody. Write them in the chat box if you would like.
Dr. Mainous?
Yes.
This is Susan Quisenberry. So there is a question. Is there
Okay.
someone I can meet with in Denton to talk about options in the graduate program in nursing? And the next question is, should I contact the people on the slides depending on the program I'm most interested in?
And yes, I would say yes. Melissa Rodriguez, are these slides made available to the participants today?
We can make it a PDF if you like and see if we can put it on the, I'm not too sure what the format will look like on the website, but we can look into it.
Yeah, I would like, some of them there were links in it for folks that were interested, all the contact information. It might have been difficult to get the contact information down quickly as we went through. And so for this particular individual, we'll get her the materials, and then she can take it, she or he can take it from there. Any other questions?
Dr. Mainous, a lot of times we get asked for nurse educator. We know that there's like a minimum amount of years that they should be a nurse, but is there anything that's like a sweet spot for amount of years to be practicing as a nurse in order to pursue that?
I'll let our director of that program speak to that. That'll be Dr. Sheriff. Are you still on the presentation?
Yes, I am. I think I heard the question as far as clinical experience. We prefer a year of clinical experience, but that is flexible in the sense that when you start the program, you don't have to have that full year in until you get to your practicums. So if anybody has a question about that, just please contact me via email or phone, and I will be happy to discuss that in further detail.
Thank you. We also get a lot of questions about health systems management. So kind of what are there's so many different kind of routes to take. How do you guide someone when they're kind of torn between them?
Okay, that'd be Dr. Toms.
Tell me what you mean by different options, so I'm clear.
Sure. So sometimes we'll have somebody in our office and they'll be looking at, should I pursue this and just keep on going through with the MBA, or should I just stick with the program itself, or should I, kind of the different options you were showing on your slide.
Okay, sure. Well, if they're sure that they want to pursue leadership, then what I tell folks is that if they aspire to work as a nurse in a magnet organization, then the best route that I would recommend for them is to get that master's in nursing. And then perhaps a certificate or something like that as an MBA, or do the dual degree if they really are interested in the MBA. But to advance their career in the future, getting that Master of Science in Nursing really is an excellent foundation and will really open up so many doors for them. If they just have the MBA without the nursing graduate degree, it could, in some cases, limit their career progression. So that would be my answer for that.
Thank you.
Sure.
And we do have a question on the chat. Demi would like to know if she's interested in a nurse practitioner track or potentially becoming an administrator. Where can she find more information to get started?
So I would probably say, number one, is there a particular nurse practitioner track you're interested in, or have you not, narrowed that down yet? But Dr. Barbara Gray is the director over all of the nurse practitioner tracks. She loves kids. Well, good. Well, that might be the pediatric nurse practitioner program, or it could be, you could also be a family nurse practitioner and work predominantly with children. So either of those two. You could talk to Dr. Barbara Gray about all of those programs, or you could also speak to Dr. Susan Quisenberry or Dr. Shelley Hawkins about the family nurse practitioner programs. You also speak to becoming an administrator. So Dr. Toms just presented on that track. And so that track is at a post-master's, well, it's a master's program right now. But we are looking at making essentially that program a component of our clinical leadership track. So that is you're going to have a possibility of a couple of different options in future on that. Let me see what this other question is. So Dr. Roussel says, depending upon your interest and your professional career goals, if you want direct patient care, MP tracks, and if you're interested in micro and macro systems, the master's degree nurse administrator program, health systems, or maybe eventually the BS into DNP in clinical leadership.
Okay, it's an opportunity to ask any more questions. If not, if we don't see any more questions in the chat pop up, then we will wrap up the session. And we thank you so much for this really helpful information and for your time today, and for all of those who were able to join us as well.
Well, thank you. Thank you for giving us this opportunity, and we'd be happy to answer any questions in future. So thank you. Have a good day.
Thank you.